of the Department of Emergency Management, Mary Ellen Carroll, as well as the Director of the Department of Public Health, Dr. Grant Koufax, the Police Chief, Bill Scott, the Fire Chief, Janine Nicholson, the Director of Human Services, Trent Rohr, and the Director of Homeless and Housing Services in San Francisco, Abigail Stewart-Kahn. Thank you all again for joining us this afternoon. As of today, we have a total of 1,233 confirmed cases of coronavirus in our city. And sadly, we have 21 people who have died from this virus. If you want more information, specific data around zip code and race and the number of people tested, you can check out our website, datasf.org/COVID-19. What we have tried to do every step of the way, whenever we have accurate information and can provide it to the public, we provide it on our tracker. We made a number of announcements about the expansion of our tracker to include a zip code and to also look at some of the disparities that exist in our city. The tracker is very helpful in that regard. It's also helpful in making sure that we are allocating resources in the places that need it the most. I want to also be clear that from the very beginning, in our Emergency Operations Center, we have embedded the Office of Equity, which is focused on making sure that all of the decisions that we make are looked at through a lens of equity, and that communities that typically are disadvantaged or left out of the larger citywide response, they get the resources and the support that they need. This past Monday, Cheryl Davis, the director of the Human Rights Agency in San Francisco, was here to talk about an extensive list of things that she and her team are doing to outreach to those communities. And I want to thank her and all of the people and the volunteers and the city staff who continue to support our most vulnerable residents. I have just a few updates that I want to talk about, and I really want to start with Give to SF. We have been talking about Give to SF from the very beginning, because we knew that when this pandemic hit that it was going to impact people financially, and the city was not going to be able to do it alone. Although we've done a tremendous job, many of our city agencies, with reshifting resources that they already have in order to meet needs that we did not anticipate, we know that it's going to be important to get assistance from private contributors. And Give to SF, we announced over a month ago, and as of today, we've raised over $10 million in private resources to help with Give to SF. And I want to be clear about the focus of this program. Number one, food security. Number two, housing security. And number three, small business support. And in particular, we knew that a few things were going to happen as a result of this pandemic. There were going to be people who lost their job, but also didn't qualify for unemployment or had no access to resources whatsoever. We knew that food would be a challenge, and although we've been able to invest more in programs and also a rent moratorium, a eviction moratorium, and a number of other things that we put into place, people were still going to need resources directly to ensure that they had food on their tables and that they had access to resources to pay their bills. And again, the spirit of the people of this city has been absolutely outstanding. It just really reminds me of how important it is that we look out for one another. And this program, Give to SF, does exactly that. And I want to just take this opportunity to just talk a little bit about what the program has already done. As I said, we've raised over $10 million for this program, and already we've allocated about $5.35 million to nonprofit organizations and other groups that have distributed the money directly to people that we need it the most, including providing grocery store gift cards to low-income and non-documented residents. because, again, we know people who are a part of our immigrant community would have probably the most challenging time getting access to food, and we wanted to make sure that we prioritize this community as recipients of gift cards, so organizations that serve our immigrant community, as well as organizations that serve various low-income populations throughout the city have been the people that we've counted on to work with us to distribute access to gift cards for grocery shopping. We're providing, as we did early on, grants to small businesses, as well as no-interest loans with flexible repayment schedules, because we want to not only provide money that people need in these small businesses immediately, but we want to make sure that they have sufficient revenue to cover their expenses. And when I think about the businesses who I know are going to need help the most, who will probably most likely not be able to recover the cost the amount of resources that they are losing as a result of these pandemics, I think about the people who do hair, the people who do nails, the masseuse, the people who cut your hair, like those kinds of services. I know that after we're able to move back into a place where we can open up those businesses, they're still going to have some real challenges with meeting the needs of their back rent and other financial issues, as well as their employees. And so we want to make sure that those businesses that may not traditionally qualify for some of the resources that could be made available through the state, that we provide them with some relief directly here in the city. So we are also providing funding for people who are at risk of losing their housing. And as I said, although we have issued a moratorium on evictions, we know that there are still other challenges besides what's happening with this pandemic that could lead to housing insecurity and concern about losing not only your housing but your business. So we wanted to make sure that we had a well-rounded network of support as a result to Give to SF, and we did just that with the goals of getting the money into the hands of the people who need it the most. And I want to reiterate that, for example, if you are someone who has access to other resources, please make sure that you are not reaching out to this fund. Because there are so many people in need. And the fact is, no matter how much money we raise, it's going to be difficult to help everybody. So if you need help, we are here to help you, but please don't take advantage of these resources if you don't need them. I want to take this opportunity to also really highlight some of our major contributors to this fund who have been absolutely incredible for day one. Salesforce, Ann and Gordon Getty, Anil Boucherie, Gershon Baker Foundation, Hellman Foundation, Crankstart Foundation, Dr. Erica Lawson and Jeff Lawson, Google, and Stumsky Foundation. These organizations have contributed a significant amount of money not only to Give to SF, but they also continue to support other nonprofit organizations throughout San Francisco and have been really an important part of the fabric of philanthropic giving in San Francisco. And so we are so grateful to them, not just because they've contributed to Give to SF, but what they do for the city. And I also want to just express that you don't have to have a lot of money to give to SF. We have received contributions between $10 and $1.5 million. And if this is something that you're able to do as a way to help others, please look at our website, Give to SF, or call 311. We are always available to take contributions, and we are doing everything we can to vet all the folks who request funding to ensure that it is reaching the people who need it the most. And so thank you all so much for stepping up to support people in our city to make sure that no one is left behind. I want to talk a little bit about testing expansion. From the very beginning, we announced a number of test sites to help some of our first responders and city employees in particular. And as many of you know, testing is very, very challenging to do because we have limited test capabilities available. And so we want to be very strategic about how we make testing available. Of course, anyone exhibiting symptoms should be tested, whether they have insurance or not. And the fact that here in San Francisco, we've not only extended our testing capacities to meet the need of many of our first responders and our healthcare professionals and our muni drivers and others, we are today taking it even a step further. The Soma location that we opened is available to anyone in San Francisco who exhibits any type of symptoms as it relates to the COVID-19 virus. And again, your immigration status, your lack of insurance, nothing should be a barrier to being able to get tested. And we want to make sure that if you think that you have symptoms, that we're able to test you, and that is all this information will be used for, is for COVID-19 testing and data. But we wanted to take it a step further, and the location where we're testing first responders and people who work in our healthcare industry, where it was just limited to that particular group of people. We know that there are a lot of other people on the front lines who are working for us every single day. And when we talk about essential workers doesn't only mean people who work in the healthcare industry or those public safety folks who work for the police and fire departments. It also means our grocery store clerks. It also means our janitors, our in-home support services, people who we need to continue to work to support other folks throughout the city. And so if you are in the category of an essential worker, the location where we are testing our first responders and our healthcare professionals, we are extending the ability to test you at this particular site. And Dr. Colfax will talk a lot more about the specifics of that, but again, we do not want anything to be a barrier to making sure you're able to get a test now, especially if you exhibit the symptoms. Dr. Colfax will also talk a little bit more about how we are limiting the number of symptoms that would allow for testing. If you think that you've either been in touch with someone with COVID-19 or in some way you're infected, we want to expand the number of people that we can test, and he will talk a little bit more about that as resources come in and as we evaluate on a daily basis our capacity. We will definitely continue to expand our ability to test more people. Last week I talked about contact tracing and trying to identify not only the person, family members who has contracted COVID-19, but also others that they've come in contact with. Our goal is to do everything we can to enhance contact tracing, expand testing capacities, because as we talk about reopening our city and our region, these tools are going to be critical to our ability to move forward in this direction. So if you are someone who needs tested, please give us a call at 311. And we will get you to a location as quickly as we possibly can to get test results. And I also want to just say, because and Dr. Colfax will probably talk about this more, is if you're an essential worker and you think you have symptoms and you get tested today and you find out tomorrow that you're negative and you're back at work and you're working, and later on, a week later, you exhibit symptoms again. We want you to get tested again if you think there's a possibility that you may have the virus, because you are out there working and being exposed to the virus because of your interactions with the public. And so we want to keep that in mind as we move on about our lives, but especially as we look at the possibility of reopening our city. These are the kinds of things that we're going to need to pay attention to in the future. I want to thank Color, Carbon Health, and One Medical, who are collaborating with us to help provide these additional resources for testing. I want to thank the Port of San Francisco and the Department of Public Health as well, because it does take a lot of people and resources to put together any of these testing sites, and the goal is to, again, to try and test as many people as we possibly can. If you have questions and you need to be tested, please call 311 or visit sfgov/citytestsf. All right, so speaking of hopefully getting to a point where we can get back to our daily lives with the city, we know that we're not there yet, but we're hoping to get there. And a couple weeks ago, I announced along with President of the Board of Supervisors, Norman Yee, our plans to start an economic recovery task force. That economic recovery task force is being co-chaired by our assessor recorder, Carmen Chu, our treasurer, Jose Cisneros, the Labor Council executive director, Rudy Gonzalez, and the director of the San Francisco Chamber of Commerce, Rodney Fong. And the goal of this economic recovery task force is to work with a number of stakeholders throughout San Francisco. And when I say stakeholders, that's just people who come from various sectors of the nonprofit, community, and business areas. So again, I go back to the folks who do hair and do nails and making sure they're represented in this economic recovery plan, nonprofit organizations that serve the community, people who are community stakeholders who help to work with seniors in whatever capacity. We want to make sure that we are thinking about what happens after we start to get back to our daily lives. What happens with our restaurants? What happens with our convention and tourism? What happens with our hospitals and our hotels? What happens with job opportunities that may no longer be available, and what other industries will become increasingly available as a result of this pandemic? How do we repurpose our educational institutions and other resources that we have available to fit the needs of what is our new normal? How do we shift our focus so that those who have lost their jobs and have no access to other opportunities or have limited skill sets, how do we reshift our focus to make sure that they have opportunities? This Economic Recovery Task Force is about the future. And just so you know where we stand as it relates to unemployment, as of April 4th, 60,000 San Franciscans have filed for unemployment, and we anticipated that another 40,000 San Franciscans in the next few weeks will file for unemployment. And putting that into perspective, the recession that happened in 2008, 2009, 45,000 people applied for unemployment. And today, in 2020, we're already at over 60,000, which means that we're going to have some real challenges with our economy. And that will not just be the economy here in San Francisco. It will be all over the country and all over the world. And how are we going to redirect our focus on recovery so that people are able to get jobs and take care of themselves and their families? And this Economic Recovery Task Force is critical to the success of our future. I mentioned last week, or maybe the week before, I don't think I can keep up with the days, but we anticipate a $1.1 to $1.7 billion budget deficit. So the city's budget deficit, a number of companies might be going out of business, restaurants, small businesses. We have some real challenges ahead, which is why this Economic Recovery Task Force and the work that they are going to do to help with planning for our future is so important. So I just want to appreciate all the work that they are doing and just remind everyone that this is going to be a very challenging time, one in which I know, because we are here to work together, that we will get through it. And in that regard, there's a lot that we're going to need to do to support our small businesses and our business community in general because of the real challenges that they face. From the beginning, we provided grants to small businesses that basically were quickly swallowed up. We have deferred the payment of your business tax until February of 2020. We actually deferred the payment of certain fees for a few months with a commitment to defer those fees to a longer period of time. And also, I think it's important as a city that we look at all of the fees that we charge our businesses and make some decisions to eliminate fees in general that have a negative impact on the ability for our small business community to return, and that is something we're going to continue to work on. And I want to just talk a little bit about the announcement that was made yesterday by myself and Treasurer Jose Cisneros to defer the collection of the business registration fee for 4 months until September 30th. This business registration fee that businesses pay, the fact that we're delaying it to September will be helpful to our business community. This will lead up to $49 million in deferrals for at least 90,000 businesses in the city. And we're also extending the deadline again for the unified license fee, which is the fee that we had initially extended for 3 months. This fee that includes charges to restaurants, bars, small retailers, hotels, tour operators, and other businesses that have been especially hit hard by the pandemic. We're extending that to ensure that we support our small business community and with an opportunity to try and reevaluate what fees we can eliminate entirely. So I just want to express the need to continue to make sure that not only are we dealing with the health impacts of the coronavirus here in the city, at the same time, there are other challenges and other needs that need to be met. And so part of what we have to do, in addition to our physical and mental health and well-being, we have to focus on our economic health. And so that's going to be a critical focus for us over the next couple of weeks. And so for any business that needs any support or has any questions, or if there's any way that we can help you, please reach out to us at oewd.org/COVID-19 or call 311. For any of the announcements that you hear today, if you don't have access to the internet, you can call 311 and you will be transferred to the right location or provided a phone number or information on how you get access to what we talked about here. And if you have access to the internet and you can't remember all these websites, because I definitely can't, please just go to sfgov.org and you should be able to find information about any city services. There's a tracker for the information on the number of people who have the virus in the city with details. There's information about food and access to food. There's information about housing and other things. There's just a lot of great information if you're looking for it, or if it's confusing and you want to just get straight to the point, you could either do a search on our sfgov.org or you can call 311. We will continue to work with our federal and state partners to get even more resources for the people here in San Francisco, but we also know the challenges with how long it can take to not only get legislation passed, but to get it through the doors where the resources actually hit the public. And we want to make sure that we're doing all we can here locally to support the residents of this city. Yes, the city government plays an important part in doing just that, but also the incredible people of San Francisco, so many folks who have been really kind to their neighbors and to others and provided resources, spending money out of their own pockets or running errands or the things that you've done, that is also very impactful as well. And we appreciate all that you continue to do to make sure that we are really looking out for each other because as we continue to say, yes, we are all in this together. What impacts one person impacts us all. If someone in the city isn't doing well, then it has a tremendous impact on each and every one of us. And so the fact that we have so many incredible San Franciscans that are extending their hands and helping out, it means a lot. So I want to express my appreciation and just end it quickly with a story about my grandmother. You know, when you are at home a lot, it gives you a time to not only clean up and do the kinds of house chores that you probably put off for a really long time. It just really gives you time to reflect and think about the people in your life and the value of experiences you've had. And I, as many of you all know, I grew up in public housing, and we didn't have a lot. And a lot of the food that we received came from the free food program. And if any of you received this food, you know it was always like a white box of powdered milk, or the silver cans of beef, or the juice, the grapefruit juice or the orange juice in the round can in white, and so on and so forth. So we got a lot of the free government cheese and everything else. And my grandmother was a really good cook, and so she would take this free government food and make magic happen. And you know what I appreciate the most, because people would come to our house, especially when they knew dinner was ready, and we knew that they were always coming there to eat. And so I remember one time I said, "Mama, why are we always feeding everybody? We don't have anything ourselves." And my grandmother basically said, she said, "Shut up, girl." She said, "Shut up, girl." She was like, "That's just what you do. Be quiet, and this is what you're supposed to do to take care of your community. You never know when that's gonna be you. So you need to take care of other people, and other people will take care of you. You never know when you're gonna be in that same situation. So just remember to be good to people." And so she always had a way of, she said it a lot less diplomatic than what I just said, but the fact is I got the message. And I think that so many people in our city, they have probably in some point of their life gotten the same message as they grew up, to learn that it is definitely a blessing to give and to be supportive of one another, and that's the spirit of what this city represents. And so I just want to express my appreciation to all of you for your continuous leadership and support and your compliance with this order. I know it's been a long time and everyone's ready to get back to their lives, but trust me, this is, you know, for the best. And we are in the process of reevaluating some of the health orders and looking at ways in which we can begin to get back to that point safely. And so as soon as we are able to evaluate that and make good decisions to protect public health, you will all be the first to know, as I've committed to every step of the way of this process, to ensuring that we are providing you with information and doing what's best and making sure that we're keeping people safe. That's exactly what we'll do when it's time to reopen our doors and to allow us to begin to gradually get back to the life we all know and miss. So thank you for your cooperation. And at this time, I want to ask Dr. Grant Koufax to come up and provide an update.
Thank you, Mayor Breed. Good afternoon. I am Grant Koufax, Director of Health. Today, there are 1,233 San Francisco residents with confirmed cases of coronavirus. I start out my remarks with this fact, to remind you that the data and science continue to tell the story here in San Francisco, and will continue to guide our response. 21 San Franciscans have died from coronavirus. This is a loss to our community, and I send my condolences to their loved ones. We know that 20 of the people who have died were over 60 years old, and all 21 had underlying health conditions. This is consistent with what we know about who is most at risk. Our hospitalization numbers for COVID-positive patients have been holding relatively steady for the past 2 weeks. If you look at the graph on the data tracker, you can see that the curve is flat. San Francisco, you made that happen. It is an incredible achievement, and I thank you. And we must continue to flatten the curve. I remain very concerned about outbreaks that are occurring in the homeless population, long-term care facilities, and other congregate living settings. As we have known, and as I have said from the beginning, that this is where the virus presents the greatest threat. If people affected by these outbreaks get very sick, it could still overwhelm our healthcare system. That is why we have prioritized vulnerable populations in these settings from the very start. And now, I want to talk in some detail about testing. As you heard the mayor say, we have made a major stride in offering testing to every healthcare worker, first responder, and essential worker who has symptoms, with today's announcement of the expansion of City Test SF. This expansion applies to public and private sector workers and also to any San Francisco essential worker with symptoms who does not have other access to testing. It is critical to test people with symptoms so that swift action can follow to provide care, contact investigation, and isolation and quarantine. These steps reduce the risk of further exposure and slow the spread of the virus. And there is so much interest and so much focus on testing across the country, state, and Bay Area. And for good reason. There have been many bumps on this road, as you well know, with false starts at the federal level in getting the right test, a reliable test, and a persistent shortage of supplies needed to conduct the test. Let me be clear. Our vision, my vision, is that everyone in San Francisco has universal access to testing. Let me repeat that. The vision is that everyone in San Francisco has universal access to testing. We cannot get there overnight, but we are certainly headed in that direction. Today, people with any symptom consistent with COVID-19 will be able to get tested. Today, people who have had close contact with a confirmed COVID-19 case, even if they do not have symptoms, will be eligible for testing. As we move towards this vision of universal access for testing, this will be a stepwise process consistent with our public health priorities in fighting the pandemic, our values to promote equity, and the feasibility based on testing, capacity, and supplies. These challenges will continue, but we will iterate and improve and respond. I want to remind you of our top priorities for testing today. This includes priorities to mitigate outbreaks, protect vulnerable populations, protect healthcare workers, frontline workers, essential workers, including first responders. Test people as a result of contact investigations that include all close contacts. And test people with symptoms who may not be covered by these other criteria. We base these priorities on the facts about coronavirus. And by keeping to them, we have been able to test everyone in those groups with symptoms, even in the face of scarce supplies and other challenges. We have been expanding testing capacity ever since we started in our public health lab on March 2nd. In that lab alone, thanks to the hard work of our public lab staff and director, Dr. Susan Phillip, our capacity, our daily capacity, has increased fourfold. We are committed to continuing to expanding that testing capacity, both in that lab and with our other partners across the city. As of today, 12,054 San Franciscans have been tested, and an average of 12% have tested positive. Here are some examples of our commitment to expanding and growing testing capacity to date. We have opened 2 city test SF sites for healthcare workers, frontline workers, essential workers, and other San Franciscans with symptoms. The health department, in addition to expanding our testing capacity at the public health lab, has opened multiple test sites in the community, including at Zuckerberg San Francisco General Hospital, Castro Mission Health Center, and Southeast Health Center. And I am happy to report that another community-based testing site will open tomorrow in the Western Addition next to the Maxine Hall Health Center. These community sites give patients the opportunity to be tested without leaving their own neighborhood, keeping themselves and others safer. These health department test sites are part of a growing capacity across the city to test people, including 26 sites across the city at UCSF, NEMS, One Medical, Kaiser, Sutter, Chinese Hospital, and Dignity Health. In addition, we are now testing all people coming into the jail who will be housed in the jail. And we will begin to test all close contacts of people with confirmed COVID-19, regardless of whether they have symptoms or not. As we look forward to our goal of universal access, the next steps will be the testing of more people who do not have symptoms. The focus must be on congregate settings, workers, and we must do this work through an equity lens. I want to expand upon this a bit because it is very important to understand the connection between testing expansion and the unwavering commitment to our priorities that, again, are based on data, science, and facts. The next phase of testing people without symptoms will include testing in congregate settings, such as shelters, long-term care facilities, and SROs. Testing of healthcare workers, frontline workers, and other essential workers. Testing in geographic and cultural communities that are affected by disparities in the spread of the coronavirus. And in reaching towards our aspirational goal of universal access for testing, we must recognize several very important points. The city and the health department will not be able to conduct all the testing required, and we will continue to rely on partners in the healthcare system and private sector. And the timeline for these next steps is dependent on several factors, multiple factors, including the ability to meet the demands of current work, managing new outbreaks, a growing number of positives, as well as testing capacity and supplies. And supplies continue to remain a challenge. We recognize, and we all must recognize, that not every positive test result can be met with full wraparound supportive services. We will continue to work with our partners at the Human Service Agency and Housing and Supportive Housing Department. But we must take a harm reduction approach. We know from experience that most people who know they are positive will take steps to protect themselves and others. And even with the efforts of the Human Service Agency and the Department of Homelessness and Supportive Housing, we must ask people to protect themselves and others. We will take the harm reduction approach, which has always been a foundation of our public health system, and an effective approach based on data, science, and facts, that most people who test positive will do everything they can to protect themselves, to protect others, and to protect the community. And it is very important that we realize that negative tests are only a point-in-time finding and should not be and cannot be a signal to forego or relax the use of precautions. Therefore, universal testing for San Franciscans will mean that all individuals have a responsibility to act on the basis of their results. To the best of their ability, they must take this responsibility by self-isolating, seeking care, taking precautions, and continuing to protect themselves, their families, and community members. And of course, our systems will do everything that we can to support individuals, their families, and the community in this work. We also recognize that science and technology is rapidly evolving and will continue to inform our response and testing strategy. As more rapid tests become available, as we have a better understanding of what antibody tests really mean and whether neutralizing antibodies confirm long-term, medium-term, or short-term protection, our toolbox of testing options will likely grow and be implemented as quickly and as effectively as possible. Again, supplies continue to be a challenge, but we are making progress, and we will continue to do everything we can to ensure that San Franciscans have what we need. And it is very important that we recognize that testing is an important piece, but it is just one piece of an overall approach to fighting the coronavirus. The mayor emphasized the importance of contact tracing, and this is a vital component and must be paired effectively and over the long term with our testing strategies. It is also crucial to continue to do everything we can to prevent people from getting sick in the first place. That includes staying at home, social distancing, covering your face when you are around other people, and frequent hand washing. It is also important that we continue to ensure that the healthcare system is on high alert and prepared to handle a surge of cases and to be able to treat everyone safely. And it is critical that we do all this work with an eye towards equity. The health department is committed to the health and well-being of all San Franciscans and to do everything we can to support the health and full recovery of all communities in our city during and after this pandemic. Thank you. Now Police Chief Bill Scott, who has been an incredible partner in our response to this pandemic, will make a few remarks.
Thank you and good afternoon. I'm Bill Scott, Chief of Police of the San Francisco Police Department. Again, I'd like to start off, as I always do, by thanking our Mayor, London Breed, and our Director of Public Health, Grant Colfax, for their outstanding leadership during this very challenging time. I also want to thank the members and the people of San Francisco for their support and for their compliance. The vast majority of the public are compliant with the measures that are meant to stop the spread of the COVID-19 virus. With that said, we do have some instances in which we've had to issue citations to people and businesses who, after being warned, continued to flout the order. To date, we have issued 16 citations that break down to 7 businesses and 9 individuals for violating either the county's public health order or the state's public health order. We've formally admonished or warned 71 people, which breaks down to 48 businesses or business owners or managers and 23 individuals. Our enforcement will continue, and in addition to those figures that I just mentioned, we've informally reached out and contacted hundreds of individuals for informal warnings to gain voluntary compliance. We've already received some press inquiries about how we will enforce the updated public health order regarding the face coverings. From the outset of the original public health order that was issued in mid-March, the SFPD has made it clear that our focus is about education, voluntary compliance, and enforcement has been an option of last resort. But I have stated and continue to state that we will use that option for those who flout the order. That model has been largely successful, and we will continue to use that model going forward in the issuance of the latest public health order, which requires face coverings. Our compliance pathway, again, starts with educating the public and asking for voluntary compliance. We then issue warnings, and formal warnings come with an incident report that our officers take if they issue a formal warning. And as a last resort, particularly for those who continue to disobey the order after being warned, we have cited those individuals or those businesses. I want to say that we are working with Director Cheryl Davis, who you heard from during Wednesday's press conference. Director Davis has mobilized key stakeholders in the community, and basically those stakeholders, along with Director Davis and other city workers, plan to distribute face coverings thanks to the mayor's Give to SF campaign. Those face coverings have been donated, and we think that will go a long way in preventing the spread of COVID-19 as well as voluntary compliance. So I want to thank Director Davis and the others who have been involved in that effort, because we really do think that will make a difference. For those that are interested in our enforcement protocols, you can visit our COVID-19 website on our department's web page and read the department notices that lay out all of our enforcement protocols. As we've stated before, the purpose of the public health order is not to arrest or cite. It's about promoting the public health practices that will help prevent the spread of the virus. And the San Francisco Police Department's role in that is to help our community get through this extremely difficult time in ways that don't make the situation worse. By working with our community members, by working with our other city partners, we have been largely successful in doing that, and we ask for the public's continued cooperation and support so we can stop the spread of this virus. Now I want to turn to our crime to give you an update. As I stated on Wednesday, we saw an 18% increase in Part 1 violent crimes, and that was mainly fueled by 11 additional robberies and 2 additional assaults. There was a 31% decrease in Part 1 property crime, which equates to 154 fewer property crimes this past week. And overall, there was a 25% decrease in Part 1 crime, which equated to 142 fewer crimes from the previous week. As we've stated, we have had some burglaries and vandalisms of businesses, and we want to assure the public and let the public know and let those would-be criminals know that we take this extremely seriously. We've made some progress on several of those investigations and are well on our way to identify the perpetrators so those individuals can be brought to justice and held accountable for those crimes. We want our business owners to know that during this difficult time, that the San Francisco Police Department will be out patrolling, particularly during the nighttime, because that's when we've seen many of these crimes occur. And our Field Operations Bureau Chief, Deputy Chief Greg McEachern, as well as our Operations Assistant Chief, Michael Redmond, and their teams are working tirelessly to make sure we do everything possible so that we don't have people being victimized during this difficult time. In some cases, our investigators, by working with the District Attorney's Office, have been able to get additional charges for looting, which is Section 463 of the California Penal Code. We've had 22 instances where individuals have been arrested and charges of looting have been brought forth, and many of those charges have been filed by the District Attorney's Office. So I'd like to thank the District Attorney and his team for working with us on that. As always, we encourage people to report crimes, but do so in a way that helps decrease face-to-face contact in the midst of the spread of the coronavirus. As always, call 911 to report violent crimes and crimes in progress. We will respond to those crimes as we always do, and we will be there for you. Please also make use of our newly implemented text 911 service if you are unable to make the phone call but need emergency help, particularly for those that might be experiencing domestic violence. If you're unable to get to the phone to make a call, please take advantage of the text 911 service. For crimes that have already happened, please use our non-violent property crimes. Please use our non-emergency line at 415-553-0123. That's 415-553-0123. You can also call 311 or utilize the department's website to file a police report online or request a copy of an existing police report. As a reminder, this is National Crime Victims' Rights Week, and we want to acknowledge and honor crime victims and raise awareness for victims' rights advocates and crime victims for what they've gone through. Lastly, the men and women of the San Francisco Police Department want everyone impacted by crime to know that we are always here to provide the service that you need with dignity, compassion, and respect. Please listen to the direction of our public health officials under the leadership of Dr. Grant Colfax. If you must go outside, please wear a face covering as the most recent order mandates. Also, maintain 6 feet of social distancing and stay 6 feet apart. Let's all do our part for the prevention of the spread of the COVID-19 virus and to flatten the curve. Thank you.
Thank you, Chief Scott. The first question is for you.
Okay.
From Marco Siller Gonzalez, KQED. How will SFPD enforce the new public health order regarding facial coverings?
Well, as I stated, our model has not changed from where we started when the first order was issued. We've been largely successful using this model. And I want to make something clear. When I talk about progressive pathways to compliance and progressive enforcement, which starts with education, admonishments, warnings, it doesn't mean we're not engaging. Our officers are engaging on a daily basis, and they're engaging with many, many people. So I want to inform the public and let you all know that, yeah, you might be contacted by a San Francisco police officer who might ask questions about either where you are or why you don't have your face covering on. Please be patient with us because we are here to help. You know, our goal is to further promote the public health orders. Our goal is not to write, you know, a bunch of citations and arrest a bunch of people. Our goals are actually to keep our public healthy and safe. So be patient, understand that these orders are there to keep us all healthy and safe, and please don't mistake the fact that progressive enforcement or progressive pathways to compliance equates to a lack of engagement. We are engaging thousands of people, and we will continue to do so because we want to get to voluntary compliance. And in order to do that, it takes engagement. And as I stated, for those that fail to get the message after being educated, warned, we will cite if we have to. We've done that, and we will continue to.
Thank you, Chief Scott. The next set of questions are for Mayor London Breed. Madam Mayor, the first question is from Maureen Kelly, Cron 4. The San Francisco Central County Committee Chair, David Campos, submitted a letter calling on the city to switch to all mail-in ballots for this November's election. Is this a possibility, and what's needed to make it a reality?
To be clear, as someone who comes from a community that unfortunately has a history in this country of not being able to have access to the voting booth, we of course take the ability for San Franciscans and others to have access to voting very seriously. And in fact, we've already started this process over a month ago, working with the Department of Elections to prepare for what could happen if in November we still are in a very similar situation to the one we're in. We want to make sure that this is in no way impedes anyone's ability to vote. So preparing to have access to more mail-in ballots and also more outreach around voting is going to be critical to ensuring that everyone has the ability to vote in this election. It's something we've already been working on for over a month, which we will continue to do so.
Thank you. The next question is from Joyce Cutler, Bloomberg Law. Madam Mayor, the Board of Supervisors passed requirements for companies to pay for or reimburse gig workers for protective equipment and sanitizing products. Will you be signing the legislation?
I just want to be clear that it's important that not only does any other company or business in San Francisco provide the appropriate support to their employees, including soap and hand sanitizer and protective equipment, especially to those essential workers. It's also important that we do so at a city level. The legislation was just passed, and so we're still reviewing it, but it's definitely something overall that I agree with.
Thank you. Also from Joyce, what is the proposed level of budget cuts, and how many positions will be eliminated to deal with the upcoming billion-dollar deficit?
As I said earlier, we anticipate, based on the Comptroller's report, that there will be a budget deficit of anywhere between $1.1 and $1.7 billion. And I think that what that means is in the upcoming budget and next year's budget, we're going to have to look at the financial projections and where we could make specific changes in order to cut the budget. We don't have the specifics as to what positions or what programs or anything of that nature might be impacted because that is something we will continue to discuss as we move through this crisis based on what we're spending, based on what we would receive in federal or state reimbursements, as well as some of the resources we've allocated, some of the revenue loss. It's not as simple as being able to answer a question like that right now to say that definitively something is going to happen. But the fact is, close to $1.7 billion projected budget deficit means that there are going to be some major shift in priorities and definitely some significant financial impacts on services in our city.
Thank you, Madam Mayor. The next set of questions are for Dr. Grant Colfax. Dr. Colfax, the first question is from Christian Cafton, KTVU. Are there any plans for additional testing or measures to address the predominantly Black, Latino, Chinese American, and other communities of color which have been disproportionately impacted by the pandemic?
Well, yes, and as I described in my earlier remarks, these populations have been a focus of our work since the beginning of the pandemic. And the health department has resources and teams working with those communities on a daily basis to ensure that they have the educational materials, the support, and access to the care that they need in order to mitigate the effects, slow the spread of the coronavirus, and of course, get the testing, care, and treatment that they need. One example would be at Southeast Health Center. We have established a field clinic so that people can get their primary care and urgent care needs met there rather than going to another medical setting. We have also established a testing site there. I mentioned that Maxine Hall Center, we will start a testing site there tomorrow. And within the Mission District, which has a high proportion of Latinx residents, Zuckerberg San Francisco Hospital is right there. We have historically, and we will continue to care for the population of all of San Francisco, but especially and including in the Mission. And an example of a collaboration with regard to learning more about what we can do better. We are collaborating with UCSF on a study of a census tract in the Mission, which has many Latinx residents, to better understand the prevalence of the virus there. So the goal there is to test thousands of residents in that census tract over a relatively short period of time to better understand the dynamics of the pandemic in that community. But I think beyond that, that's a study. I think the important thing is that we are reinforcing and building on our existing relationships with community leaders and stakeholders and ensuring that everyone in San Francisco, regardless of immigration status and regardless of where you live in San Francisco, has access to testing and care during this time, and also general health care overall.
Thank you. The next question is from Dominic Fracassa, SF Chronicle. Is the volume of testing supplies, like swabs, keeping pace with the city's expanded testing capacity? And what, if any, materials are still needed for testing and for PPE for frontline healthcare workers?
Yeah. So this remains a huge challenge. It remains a challenge locally, regionally, statewide, and nationally. It's very, our aspirational goal for universal testing is further complicated in implementing because on a day-to-day basis, I do not have the metrics needed to really be able to plan as intentfully as I would like to be because by day-to-day or week-to-week, the supplies that we order, it's unclear whether those supplies will arrive. Orders are often being canceled. There is simply no centralized system to help local jurisdictions figure out in a clear way how do we expand. Right now, where we stand, we have enough testing materials and enough protective equipment to expand to that next set of eligibility criteria that I talked about, people who have any symptom consistent with COVID-19, close contacts of people who are known to have COVID-19, and then as we expand to these broader populations in testing, it's going to be an iterative process, and some of that, if not much of that, will be very dependent on these supply chains stabilizing over time.
Thank you. The next question is from Marco Soler Gonzalez, KQED. Based on the fact that Santa Clara County's fatalities from COVID-19 were weeks earlier than they had initially believed, are there any indications that San Francisco's first death may have also been earlier than we initially believed?
So I do not have indications of that. It is theoretically possible, and we are having conversations with our medical examiner to determine what, if any, retrospective analyses could be done. I would say from the beginning of this pandemic, we have been vigilant in testing unexplained cases of death for COVID-19, but it's certainly something, given the data that was released yesterday, that we will be looking at.
Thank you. The next question is from Kathy Novak, KCBS. Will essential workers, including the uninsured, seeking tests at the two sites, need a referral?
So with regard to this testing program, people can go online and are screened online for eligibility, and then they can take the next steps depending on their answers with regard to receiving testing at those sites.
Can the city start to reopen before we reach the goal of universal testing for all San Franciscans?
So I think there are a number of factors that will help us determine, based on data, science, and facts, how we will potentially relax the shelter-in-place order. Certainly, expansion of testing is one important tool. Another important tool that is linked to that testing is the ability to do aggressive contact tracing, so that in places where there are outbreaks, we have the capacity to quickly and flexibly respond. And then we also need to ensure that there's a consistent methodology to how we ensure that there's capacity in our healthcare system in the event of an outbreak or a surge in need. There are many other components to better that will help us determine relaxation of shelter-in-place orders. And those numbers of switches that we turn on over time, we also need to be flexible and have the capacity to shut those switches down if indeed we start seeing coronavirus cases increase.
Thank you. The next question is from Loy Almiron, Mission Local. Dr. Colfax, you mentioned that lab testing has increased fourfold. What is the testing capacity now in numbers?
So I was specifically talking about our public health lab. That is one of many labs in the city that are doing testing now. But at our public health lab, we increased from being able to do 50 a day to 200 tests a day. It's really, and that's with regard to the machines that are used to do the test. The mechanical capacity to actually run the test is generally not the rate limiting step here. It's really around the supplies, it's around operationalizing it, and it's around ensuring that test sites are expansive and meeting the populations most at need and focusing on these vulnerable populations.
Thank you. Another question from Loy. To clarify, the expanded testing for essential workers can be conducted at the 2 City Test SF sites, as well as for residents who exhibited symptoms or were exposed to confirmed COVID positive cases.
So the 2 testing sites are really focused on providing city workers and other essential workers with access to testing if they have any symptom consistent with COVID-19. And then through our public health work in collaboration with partners across the city, we will be testing people who have come into close contact with somebody with COVID-19, even if those close contacts do not exhibit symptoms of COVID-19.
Thank you, Dr. Colfax. The next set of questions are for Director Abigail Stewart-Kahn, Homelessness and Supportive Housing. Director, the next questions are from Leslie Molina, San Francisco Public Press. In recent weeks, city officials have discussed the possibility of opening sanctioned encampments to help homeless people better socially distance themselves. Does the city have a timetable for opening these encampments?
Thanks for the question. I want to take a moment to frame all of the steps that are being taken around people who are living unsheltered in our community and to underscore how critically important that those individuals are to San Francisco and all of our partners. We know that living unsheltered puts you at increased risk in addition to the tremendous vulnerabilities that many of our unsheltered neighbors experienced before the global pandemic. Immediately as this became an issue, the Healthy Streets Operations Center paused their resolutions and began providing, under the leadership of Jeff Kozycki, social distancing, access to food, services, and really trying to encourage and work with our unsheltered neighbors to physically distance even while unsheltered. I want to implore those people living unsheltered to take heed of our HSOC partners' requests and to physically distance as much as possible, and to continue to ask all of our partners who are out there how to access the resources that are available. Recently, we've been able to launch a very significant food program for people who are unsheltered, which will help people to move out of the densest neighborhoods that they're living in now, thanks to a remarkable collaboration with the Salvation Army and the City and County of San Francisco. To get to the question of safe sleeping, we know that it isn't always possible in sidewalk spaces or in tight areas to safely sleep. The Healthy Streets Operations Center is evaluating the possibility of safe sleeping and whether the global pandemic of coronavirus warrants the movement in that direction by the city. I want to note that many cities across the country have had sanctioned encampments in the past with mixed success and safety. And so the city is evaluating whether the coronavirus makes that more urgent now and is working towards plans towards safe sleeping sites for the most impacted neighborhoods and individuals living in San Francisco. We'll be able to provide more information in the coming days and weeks. The final thing to note, and the mayor is always so exceptional around this, is the reality here. The reality is that the very people who will help us open these safe sleeping sites are the same talented individuals who are helping us to open hotels. And so we cannot, without the help of our providers and all of our DSWs and city workers, open all of these things all at the same time safely. And so we need to have a very focused conversation around how do we bring unsheltered, vulnerable individuals into hotels in a safe way, and we've spent a lot of time talking about the steps required there, as we also consider safe sleeping sites.
Thank you, Director. That concludes today's press conference.